Hi YouTube, it's VSG Smile. This is my 5-month post vertical gastric sleeve follow-up video. And I have not posted in a couple weeks. In that couple weeks time, I have went down a few ounces. My highest weight was 274.3. On the day of surgery, I was 256.3. I'm currently 216.8, and I have been 216 for a couple weeks. Sometimes it goes up to like 217 point something. But something very interesting happened today. Actually, a couple things. For one, I was talking to my colleagues. One has also had the sleeve surgery. She had it about 6 months before I did, though. And she was complaining about hair loss. Her hair is so thin. She points out the fact that she has bald spots. She's trying new treatments to thicken up her hair, or to make it look fuller than it is. And one of our colleagues asked me, who knows that I also have the surgery, how my hair is doing. Well, right now, and I have an extra little piece in there for those who can't tell, but my hair is pretty full, pretty normal. Normally my hair is, not super thick, but since having the surgery, it has not been. Actually, my hair is in much better condition than it was before I had the surgery, for sure. It looks much better, it looks much healthier. Actually, before I had the surgery, my health was not in as good a condition, so my hair was kind of dry, and it just, styles didn't last. When I would get my hair done professionally, styles would not last on my hair as long as they do now. So my hair is actually in much better condition. And so, I told her it could be because I've not lost as much weight as my colleague did. Maybe that's why I don't have that trouble with my hair. I do take biotin, but my colleague said that biotin has done nothing for her. She still, dealt with her hair problems. And so the other colleague who has not had the surgery, she asked if I was disappointed that I had not lost as much weight as my other colleague. And I told her, no, I'm happy. For one, um, she had more weight to lose than I did, and she started 6 months earlier than I did as far as her weight loss surgery, and I'm fine. And so that kind of something that was in the back of my mind. And for some reason today's exactly 5 months post surgery for me. I had surgery on February 29th. Today is July 29th. For some reason, I was thinking of someone whose video that I had watched a long time ago. This particular person had the sleeve surgery in my town where I also live. About a year later, she started following up with another doctor for a second opinion because she felt like the sleeve was either too large. She said sometimes that she felt like she never had the surgery at all. By the time they did some kind of, what do you call it, endoscopy or some kind of procedure to test her sleeve, the second doctor said the doctor who did it originally made the sleeve too large. It was dilated at the top and at the bottom. She had only lost 36 to 39 pounds 8 months post-op, and I think that went as far as a year. Like a year after having the first surgery, she had only lost like 36 pounds. She worked out consistently. She said she ate healthy. She was able to get her insurance company to pay for a second surgery, a revision surgery, with the second surgeon with a different hospital system. And the second doctor wrote a letter of medical necessity saying that her first surgeon kind of botched the job or didn't do a good job, what have you. Well, I remember hearing her story before I had the surgery. I know she lived in my area, but she never specified in the videos that I saw who did her first surgery. She talked about who did her second surgery. So today, she just came to mind. I looked her up, I searched, I found her. I started going back through her videos, and specifically during the period where she was considering the revision and after she had the revision surgery. And finally, she said the name of her first surgeon that did her original surgery. And it happened to be my surgeon that did my surgery. And she said, do not use this person. I highly do not recommend it. And I had to listen again, like, what? I know she did not say my surgeon's name. She did. And it was interesting because I have an appointment next week to follow up with his partner to look into getting some kind of metabolism booster or diet pills, so to speak. She said the same thing. And that's why I kept listening to her videos because her story sounded so familiar. She said after losing only 40 pounds, the surgeon recommended that she get on diet pills. That's what she called it. He told me it's like a metabolism booster and appetite suppressant, what have you. And my heart kind of sank because I've lost 40 pounds since surgery. Granted, I've lost mine in 5 months, and that's where she was at 8 months. So, surely, hopefully, I will continue to lose weight, but it really kind of put a thought process in my mind. Not anything, I don't have anything bad to say about my surgeon, but perhaps the sleeve that he does, the way he does it is larger than other surgeons' sleeves. The bougie or whatever they use to reduce the size, the way he does it is a lot larger. It kind of helped me just to hear that, to give me some kind of explanation of why some people are losing weight so much faster than I am. You know, as I've said in previous videos, I'm completely staying positive. I have no regrets. I'm very happy with the weight that I've lost. I'm 60 pounds down from last year. My health issues have resolved. Last year, I was literally on medicine, like different type of medicines, every couple weeks. I kept coughing. Um, they were unable to figure out why I kept coughing. Turned out I had a large hernia. My stomach had herniated into my lung area past my diaphragm. Stuff like that. My doctor was able to repair that, and I'm so thankful and grateful to him for that. Um, I just think knowing what I know now and watching this young lady's video, I'm realizing that I'm probably going to have to work a little bit harder to push past the 40-pound mark. She said there's actually three other people in this area that she has spoken to who have had the same experience of only losing like 40 pounds or so with the particular surgeon that we all have had. And they actually wanted to pursue some kind of medical claim against him. I don't know where that went because this is someone who had posted a couple years ago about this. You know, obviously he's still able to perform surgeries because I just had mine done this year. So I don't necessarily think that he's a bad surgeon at all. Like I said before, I think just the size of his sleeves that he does is a bit larger than sleeves that other surgeons do. Just it is what it is. But that is how I ended my night. And I did make a video previously that I'll post as well before I got this news. But basically, I'm happy. I'm happy that I had the surgery. I was a little sad, a little disappointed to see that this lady who I recalled struggling had the same surgeon that I had. I'm glad that at least I know. But from there, I'm just going to move on and do what I have to do. I did mention in my previous video that I'm also going to post that if anything, if any other surgery that I probably will have, it may be a tummy tuck just to tighten up my stomach area because my stomach is kind of flabby. Like the more weight I lose, the more I get that stomach apron type of thing going on. So if anything, I might have that in the future. But other than that, I don't have many more complaints. Just want to throw that out there. If anyone is dealing with any kind of stalls, you might want to check with your doctor and see what size bougie he used. For me, I didn't ask my doctor. To be honest, I was terrified of the surgery. I told him, you know, I trust him, I trust God. That's all that mattered. He didn't have to give me a lot of details about the surgery because that would just freak me out. So I didn't ask those questions. And now looking back on it, if I had been a little bit braver to find out those details, I might have found out things a little bit earlier. That just would have kind of prepared me a little better and would have caused me to be more in tune with what's happening, you know, with my body and within my body. But that's all. I just wanted to share that 5 months out, 40 pounds down since surgery, 60 pounds down overall. Um, Hoping to continue to lose weight. Um, I'm not quite sure how my particular sleeve, having it at a larger size. And this particular lady whose video I watched, she said that at the top of her sleeve, it was dilated. It was thin towards the middle, the tube part, but then it was dilated again at the bottom. She said that she would eat and she would feel full fast when the food was in the top part of the dilation, but once it moved through the tube and down to the bottom part, she'll get hungry again really quick. And that's one thing I noticed. I have the same kind of symptom going on. I do get hungry kind of quick. But one thing that she pointed out after she had her revision surgery, she went back to her protein shakes, of course, and I realized I do have a lot of protein powder still that I've stopped utilizing, and I definitely think I probably should go back to my protein drinks. Protein definitely helps you to feel fuller a little bit longer, and I have so much left over, so many different flavors. I'm definitely going to give that a whirl. And so my goal is to get out of the two teens and into the lower 200s, and so eventually I can break into Wonderland. This is definitely a journey. It's a lifelong process. I'm glad that I'm slowly going through the process because I'm learning a lot as I'm going through this journey, and I feel more confident as I'm taking the weight off and learning how to take the weight off that I'm going to learn what I need to learn to keep it off. So I'm really excited about that. But best wishes to everyone on your journey, and thank you for listening to mine. Feel free to ask any questions, subscribe. I will definitely post another video after I have my follow up appointment next Friday, and I will let you all know what I decide to do, whether I decide to take any kind of metabolism booster or appetite suppressant, or just tell the doctors, whatever, I'm just doing my own thing. We'll see. It just depends on how the doctor presents it to me. I'm really not a big fan of medication. I've not gotten back on any of my medication after surgery. I tried like taking my birth control pill, tried taking my um, blood pressure medicine, but I just realized every single pill, drug, medicine that you put in your body has some kind of side effect. And I don't want to deal with these side effects. So even if I am prescribed something next Friday and I take it, I might take it temporarily and not continue with it because I'm really trying to get my body to a natural state. That's one of my ultimate goals. So anyhow, I'm just talking, talking, talking. But I just wanted to do this follow-up video, let you know I'm doing all right. Hope everyone else is doing great. And I will follow up after my next appointment on next Friday. All right, have a great weekend.